Okay, here we are, down to the finish. But this is a very important finish. Today we have Dr. Karen Truman, who I consider an expert on Alzheimer's and dementia. We've known things for many years. She was one of my first teachers on learning about Alzheimer's and dementia. And anyone who stays through this session right now, you can apply to get a CEU, and Karen will show you all about that. So take it away, Karen. We can't see you. There you go. You got it.
Okay. Hi, everybody. Good afternoon. Glad to be here. We had to do a couple last minute things, so sorry about the background here. Can I make this larger, Tom? Can I get on to this? Tom, I'm sorry. Kurt, can I make this I don't know how to make this page. Share screen. Because I see other ladies on here. We're having a little bit of technical stuff. Hang on a minute. Oops. I just, I want to get
share
my
screen, it's going to go with it.
Okay, it will.
Yes.
Oh, that's what I needed to know. Okay, just like I do. Okay. Oops. There we go. Maybe share. There we go. Okay, there it is. Okay. Thank you all for having a little bit of patience here. I appreciate that. I'm Karen Truman. We're going to do 1 hour. And for those of you who are, different in different disciplines in long-term care communities and facilities, or if you're a med tech, if you're a CNA, if you're a nurse, anything like that is gonna be really important for you to do this. So, oops, didn't mean to do that. Go back up here. Okay, so we have the conference up here, and Kurt, how do I get to the next page here? Is this one? This is the next. It won't go to the next page. I'm so sorry. We had a scramble to make this happen, and I apologize. Where is the next? It won't. That's what I was doing. I was clicking on that, but it won't come up. It won't come up. So
sit there, please.
Yes, sir. Okay, hang on. Ah, there it is. Okay, now we got it. All right, thank you. All right. Okay, so we're going to do some identification of different distinguishing between normal aging and memory loss. We're going to identify the characteristics. When you see the word ADRD, that just means Alzheimer's disease and related disorders. That's kind of how they put it out there from the different state agencies. So we're going to learn how to communicate a little bit more effectively. We're going to find some available resources. Resources are your key to this whole thing. And plus, you're going to find how to get a proper diagnosis. That's really, really important. So, and your legal stuff, your financial stuff, how do you pay for all this care? It's going to be very important to know that. So let's do the pre-test. And okay, 4 participants have raised their hands. So can I get in there to talk to them, or do we not right now? Okay, can we hold off till the end of the thing, and then we'll answer any questions that you have. And we're gonna work on the pre-test. So whoever's with me right now, the core values of Alzheimer's care are dignity and respect. And of course, that's true. I know I can't hear you. So 5 people have raised their hand right now, which is great. I'm glad to know that. We're also gonna talk about, before I forget, you're going to get a 1-hour certificate. You have to make a $10 donation to my nonprofit organization. And we're going to have that put up on the screen for you to know exactly what you have to do in order to get that certificate. Okay. And it will hopefully appear, your name will appear exactly as you want it to appear. So you're going to send me an email and we'll get all that worked out for you. Okay. Thank you. So we have, there are medications that can cure Alzheimer's. Is that true or false? Well, right now we know that's false. So those are just some things to talk about, to think about, to listen about, because there's just so much going on with Alzheimer's. I can't even begin to tell you. And the different psychosis of it, the different meds that have been around for a long, long time. There's new meds on the horizon. Verbal outbursts of cursing, arguing, and threatening may be expressed by a person with ADRD. Yes, that's very true. Okay. Dementia is not, number 4, dementia is not a specific disease, but rather an umbrella term or category. What do you think of that? Dementia is an umbrella term. So it's like if you said, I have food. Well, the first question I'm going to ask you, what kind of food? So it's an umbrella term. What kind of dementia? Okay, if somebody told, if the doctor says you've got cancer, the first question you're going to ask them, what kind of cancer? But people just say, oh, they've got dementia. That's not good enough because each dementia is treated differently. They're very unique in their presentation. So we need to kind of look at that a little bit differently. Okay, Alzheimer's, Parkinson's, Lewy body, and FTD are all irreversible causes of dementia. What do you think of that? Anybody know what Lewy is and FTD? Is that a flower company? No, that's true. They are all irreversible causes of dementia. We're going to talk a little bit more about those a little bit later. Frontal temporal dementia is the FTD one. Okay. Smoking is a risk factor for vascular dementia and has been shown to cause about 40% of all strokes in persons under age. Anybody want to take a guess? It's under age 65, D. Okay. The most appropriate time for creating a durable power of attorney is it's before. You want to get that stuff done before, way before, so that you can, make sure that you have all of those ducks in a row. And I'm sure if you listen to Sean the other day, so, those are things that we need to really address early. I have my durable power of attorney. My husband has his. We have one for his mother, who also has Alzheimer's and Lewy body. So I get it. I'm a total caregiver, been there, done that, wrote the book. So those are kind of things to think about. Okay. So it's before a diagnosis. You want to make sure you have the right presence of mind to do these things. Okay. Do Alzheimer's and Down syndrome share a genetic connection? What do you think? Yep, they do. They do. They're on the same chromosome. So if somebody has Down syndrome and excuse me, and they didn't used to live as long because we institutionalized Down syndrome people. So they didn't live as long. So they didn't live long enough to develop the Alzheimer's. But yes, now they do. They live a lot longer because we keep them at home and integrate them into society. And I was just on a vacation, and there were several in the crowd that had Down syndrome, and they were just having a blast. So they were just full of life. It was beautiful. But yes, they do share a genetic connection. And a person with Alzheimer's may not recognize themselves in a mirror. I'm sure we've seen that a lot. We've seen that over and over. And, they just don't realize who that person is because they don't recognize themselves anymore. And it gets very difficult. That gets extremely difficult to not recognize yourself in a mirror because you are looking so different than you looked even a couple of years ago. So I always tell my facility people, make sure you take pictures of your residents every couple of months, because the longer they're with you, the more they're going to change. This disease changes them, and they're not able to take care of themselves like they used to. So it gets really complicated. Okay. So how do we understand the disease? Well, we're going to look at this. It's an irreversible process. It's progressive. It's a brain disease. It's slow. We can't see it. That's the problem with it. We really can't see it on the outside. It's not like the person, is missing a limb that we could see. It's not that way. We really cannot see that. So it's very hard for people to understand what's really going on in the brain. And then they can't really carry out the simplest of tasks. They have intellectual losses. They can't remember. They just asked you the same question 50 times and they still don't know. I went through this. I go through this every single week with my mother-in-law. Every week I go through the same questions. Well, why isn't anybody coming to visit me? Well, because they live a far away, far away, and we have COVID, and they might not be able to travel right now. But she'll ask me over and over and over. So, I really get it. And usually the people who get Alzheimer's, they will come after age 60. That's the normal onset, if you will, the later onset. If it's early onset, that means they're under age 60. It doesn't mean they're just in the early stages. It means that they have early onset. Our youngest one that we ever diagnosed was 27. So it can be a very young timers disease too, not just old timers. So it gets really interesting out here. So anyway, it really can take place in the brain over a long period of time. And it's likely that the causes include some mix of genetics. We can't help who we are. Environmental. Sometimes what we're exposed to in the environment, there could be lead in the water. We could have been exposed to chemicals in the service, the different toxins, and our lifestyle. Lifestyle might have a big influence, so if you don't take care of yourself, that could be very, very bad, if you will, down the road. So Alzheimer's was first identified in 1906 by a German psychiatrist named Dr. Alzheimer. He worked in what in those days was considered an insane asylum. And in that insane asylum, he had a lady that he was fascinated with because she was only in her 40s and she did not fit the definition of any brain disorder person that was known at the time. Now, remember, this is the early 1900s. So, so when she passed away after she refused care, she had pneumonia, she was full of bed sores and everything. When she passed away, he asked her family's permission to autopsy her brain. And when he autopsied her brain, he saw what he was the first to describe what are called the plaques and tangles. So plaque in the brain form and then they tangle up the neurons and the brain can't function. It can't move because it's like gum and, everything gets tangled up and it just kind of stops. And then those neurons die. But that's what's considered the hallmarks of this disease process, the plaques and tangles. So, if you hear that term, and that's what destroys the brain. So it gets really, really hard out there. It's very complex and, we don't want that damage, but once it starts taking a hold of the brain process, then sometimes it just goes very quickly. So here's a picture. And we have a healthy brain, and then we have a severe Alzheimer's brain. So you can see the differences between the two. We want the one on the left. Okay, we definitely want that healthy brain. We don't want it looking like cauliflower. That's not a good thing to look like. All right. So that's the process here. And, you know, if you have Alzheimer's, and I see you today and I see you tomorrow and you're like, who are you? And I'm like, well, don't you remember you took my class, or you were, you know, I saw you at church or whatever it was. And they don't remember, they forgot the entire thing. But if you kind of prompt them, and sometimes people need a little prompting to, oh yeah, I remember now, we had lunch together. Yeah, okay, they just forgot part of the experience. So that might just be normal aging. And as we age, we seem to lose a little bit more and more. We have to be prompted a little bit more. I have to go back into my database and kind of go through the alphabet sometimes to come up with the right answer. So, or the right person. So we tend to forget a lot of names and pins and different things like that. I get it. I totally get it. But if we can still remember it, we're probably okay. So, you know, those are things that we have to just kind of goes with our aging. Absolutely. So the characteristics, we have 3 stages of Alzheimer's. From the time of diagnosis, a person usually lives from 3 to 20 years with an average of 8 years. So we have the early stages. They're kind of getting a little bit noticeable, but that person can still function independently. And then the mid stages, the personality is starting to change. Maybe that person is getting a little bit more aggressive. Maybe they're getting a little bit more violent. Maybe they're getting more combative. There could be a lot of changes. There could be psychosis going on, hallucinations. There could be a lot of different things happening. They're definitely not taking good care of themselves. They might be just eating, you know, sugar and coffee or something like that, donuts, whatever, because they don't know what else to do for themselves. They're just sitting and watching television. They're not doing anything. So that's when, you know, usually the mid stages is when some families start to really notice some things are going on, and they might start them in an adult daycare. They might start looking around for services. They might start getting that elder law attorney involved. They could get other family members involved. I always say, make sure you have a family plan, if you will. You need to get onto, you know, into a, you know, maybe a family conference of some kind. Zoom works really well for that, because you have a lot of decisions to make. And you need to find out, what is dad or mom eligible for? How are we going to pay for $5,000 a month in a facility? You know, who do I call? Where do I get services? What kind of support is there for me? There's just so many questions going on. And as they go into the later stages, they're very dependent, totally dependent on others for even their most basic needs and activities of daily living. Their grooming and their eating and you know, bathing, all those kind of things. So when we say the word dementia is, you know, all these things are associated with a form of dementia. We have language issues, disorientation, memory problems, behavior issues, judgment, confusion. So all those things go under that heading, that umbrella of dementia. And, you know, but that doesn't mean it's Alzheimer's. There could be a lot of different kinds of dementia that, you know, so, and I'm going to talk about a couple of them in a minute here. Dementia is a general term. It's like the word cancer. It's like the word food. It's just a general topic. It's an umbrella term. So, you know, I have clothes. Well, so do I want to, you know, do I have pants? Do I have tops? Do I have formal gowns? Do I have shoes? They're all under that heading. So it's really important to know what kind of dementia, because each one's treated differently. So I'm going to talk about some of the irreversible things. Irreversible dementia. So we have Alzheimer's. We have Lewy body. Lewy is very, very prominent right now. We have Parkinson's, we have vascular, Huntington's. I was just with a family whose loved one has Huntington's. She was diagnosed at around 50 something, and she's in a facility, and it's really hard. Huntington's affects, there's a childhood form, it's always inherited. So this is a brain of a normal brain over on the left side here, and this is a brain with Huntington's. Huntington's just destroys a lot. It's just a whole different dementia. The chronic traumatic encephalopathy, that is the football players. A lot of them, and somebody that's had a lot of head injuries, the boxers, we think of Muhammad Ali, we think of all the football players that have committed suicide because of this. They have that post-traumatic stress disorder. But look at how shrunken this brain is. That's advanced CTE. That is really a big deal. And it's very real. Boston University is doing all the studies on the CTE brains, and Huntington's, we have Harvard and Stanford doing all the brain autopsies for those diseases to do more studies to find out what we can find out in the future for possible help or cures or whatever. It's very important to do brain stuff, brain autopsies. So we'll talk about that in a minute. So here's a normal brain, here's an Alzheimer brain, and here's an FTD, frontotemporal dementia. Lots of weird behaviors associated with FTD. Sometimes it's inherited. They don't really understand it very much, but it really can affect people in a bad way. So there's a lot of things going on with FTD, frontotemporal, and they will take food off another's plate. They will urinate in the corner. They have no self-awareness. It doesn't matter. If they see something on the table, they're going to try to eat it. It can be a very, very devastating disease process. So now this one is really interesting because we have the cigarettes. I don't know where the rest of my slide went, but it was down there. But anyway, there's this slide says it shows if you do nothing and you weren't a smoker, that's how your brain would look. It looks pretty healthy there. But by the time you've had 3 cigarettes, it's really clouded up. It's really made a change in your brain and the way you function. And down the road, when you keep doing that, it's really gonna destroy those vessels. So just a thought for you. Here's a normal 43-year-old brain, and here's a 43-year-old alcoholic's brain. So alcohol does affect very deeply also. I like to point that out because I think it's very important. I'm not talking about the, glass of wine a couple times a week. I'm talking about the chronic, the 6-pack for breakfast guy. Those are the kind of things we're looking at. So there's a lot of things, or if you're very susceptible to things like that. So, we're all different. We're all made up a little bit differently. And, those are some of the things that we have to look at, because is this really going to affect me down the road or not? So, and do you have that's why we need to take good care of ourselves. Linda preaches that all day long. I preach it all day long. And I think it's so important that we really start taking this stuff seriously. Okay, so certain medical conditions can cause memory problems. Okay, so, and they may go away once the condition is treated. So we have, emotional problems. We've all experienced emotional problems these last 2 years with COVID. I mean, this has been unbelievable, unprecedented. We don't even know how to act sometimes. I couldn't go in to see my mother-in-law. Nobody else could go in either. There's a lady that married Daniel that made a big difference and became a dishwasher in the facility her husband was in, just to be able to visit with him. So there's a brand new law now that just came out signed by DeSantis that said, and it's a brand new law on visitation, and it just went into effect in April. So we are not going to have that situation again. We are going to be able to go in and visit, and whether they're at the end of life or, just need somebody to be there with them because of their anxiety or whatever it may be. So we have vitamin deficiencies. We have that Wernicke-Korsakoff syndrome. That is something that we see in chronic alcoholics. I just showed you that brain. We have blood clots, tumors, infections in the brain, delirium, head injuries, thyroid disease. I have thyroid disease. If my husband makes sure my thyroid pill is out there every day, because if it's not, he knows I'm going to get crazier. So, we kind of watch out for that. If you have bad kidney disease, liver problems, all these things affect the brain in one way or another. And do you know now that Alzheimer's is considered type 3 diabetes? So that's the thing that we're also looking at. There's a lot of people with diabetes that have now are starting to show some cognitive changes. So, and they're looking, people with diabetes have a 4-fold risk for developing Alzheimer's. So, not everyone with type 2 will develop it, but the risk factors are going to keep adding up. So we need to really, really take good care of ourselves. That's my message. Take much better care of yourself than you think you are. Okay, so, and make sure you are sleeping. Sleeping is so important. So we need to, take good care, make sure our bedroom is comfortable, quiet, dark. Don't be having that TV on. Don't be having that music on. Because your brain needs to take out the trash. And the only time it can take out the trash is when it's totally quiet and dark. And it won't take out the trash. It's just like leaving your car engine running all night long. If you leave that TV, I don't care if it's on mute or not, your brain is awake every time that commercial comes on, and it'll reintroduce it. So don't do that. Just turn it off. It's okay. You didn't grow up that way. Who taught you that? That's the way I look at it. So, you don't need that. Very important to turn it off. Cognitive symptoms, we've got a lot of behavioral and psychiatric issues, activities of daily living. There's some complex range of physical, emotional, cognitive, and behavioral issues. Maybe they're seeing something that's not real, not present. They're seeing animals or children, bugs on the walls, all those things, smelling odors that others can't smell, hearing noises and voices when others don't hear anything. Those are all very real to them. So we have to validate. It's very hard for us to validate sometimes because we're like, what are you talking about? There's nothing going on here. But that's very, very important to just validate them, because that way you're going to avoid arguments. And when you avoid arguments, it's a win-win situation, because they are really, really insistent. And if you keep arguing, you're going to lose. You're going to lose that argument. So don't go there. It's how important is it? That's the best way I can think, so they're going to have maybe some false beliefs or opinions. They're thinking that their spouse is having an affair, their mama is still alive. There's a lot of ways to work around that. That's where support groups come in handy. You can talk to other people. There's books on this stuff. There's a lot of different help out there. So, those are things that we talk about in different group settings. So maybe they believe that the medicines you're trying to give them, that's poison. I don't want that. Get it away from me. So we really have to work on all that. Are there strangers in their homes? Are there different things, irrational distrust of others? Okay, so there's a lot of different things going on here. Okay. And we have early stages. Is it really safe for mom to keep driving to Publix? I don't know. That might not be a good idea. But maybe the doctor says it's okay for a short time. We'll see what happens. A lot of them might voluntarily give up their license for their own safety. But if there's two drivers in the house and you're both on that policy, and the one that has a dementia was told not to drive, but went out there and drove anyway, it might affect your policy. So be very aware of that. I don't know the answers to those, but there are ways to report that person to the Department of Highway Safety, and they will get a letter in the mail that states that they would have to go back to the driver's license office to get retested. So that might be your way out, and that's anonymous. So that might be your way out. Just a thought for you. Okay. We have middle stages, and that their awareness is going down south. The agitation, wandering, temper outburst, depression, disorientation, all those things are starting to really become more and more. The end stage, again, that's when they're in long-term care by now, I hope. Some of them will be kept at home, but I hope you have a village to take care of them, because it takes a village. One person cannot do it. And the statistic is that 60% of caregivers will die before their loved one because they're so overwhelmed, they're exhausted. So you always want to make sure you get help, okay? And that's a really, really important step on the journey. We need to stop and we need to get some help. We need to go to adult daycare. We need to find some respite care. We need to call family in. There's a lot of things that we need to keep doing, okay? Communicating, so the early stages, they're having trouble finding the right words. They're poor judgment, the memory loss. They may ask the same question. They're going to get lost in a simple conversation. They're going to misplace personal items. That happens very often. Okay. They have apraxia. They have forgotten how to use a fork or a knife, a toothbrush. Anomia, they've forgotten the names of objects, so they might use other words in their place. We call that word salad. We have personality changes, trouble with routines, and the big one is a decline in grooming. Grooming is a big deal, and they're going to wear the same clothes over and over. Oh, I just wore that for a couple minutes. It's not dirty. They're going to be unshaven. They're going to have an unkempt look, if you will. So that's very, very common. So that's why I pay a little extra to have my mother-in-law have the beauty salon every week at her facility. Yes, it costs us a lot of money to keep her there, but we're doing it. And she's 90 with, like I said, Alzheimer's Lewy body. She's down to 75 pounds. She's 4'6", and she still knows me. So I guess, God love her. That's the best I can tell you. She's looking for her white robe. I don't know where it is, but she's looking for it. So dressing is hard, and remove their soiled clothes. Just take them out of there, tell them it's really dirty. We're going to have to do some laundry, and I'll take my clothes and we're going to do them all together. So you just have to go with their journey. Middle stages, they're going to say, when do we eat? You haven't fed me. I have no food, so that's going to happen a lot. Disorientation to person, place, or time. They may not know their relationship to you. They may think the time frame is 40 years ago. They're going to try to, make out with you even sometimes. So I have stories about that, but I won't go. I don't have time to do that now. Inability to perform skilled movements, so they can't remember how to tie a shoelace, to brush their teeth. Language, maybe they're going back to their native language if they grew up in another culture. Social withdrawal. They're going to have a lot of depression. They're going to be very awkward in a new group. I can't go over there. I don't know those people. I don't know who they are. And they're going to be very, very awkward, just like little kids. They don't have those social skills anymore. And then they're going to make some comments that are very inappropriate, rude, cruel, maybe undress in a public setting, agitation, very confusing, restlessness, fidgeting, pacing, aimlessly wandering. There's a lot of that going on. I was talking to a man the other day whose wife, she goes through a walker every 3 months because she constantly is on the move, constantly. She wears out her shoes, she wears out her socks, she wears out her walker. It's just constant. So very interesting. Sleepiness or severe sleep disturbances, their need for assistance, sundowning. Sundowning is very real. Sundowning usually happens between 3 and 7 in the afternoon. The sun is starting to go down. They're a little bit tired. They're hungry. So I always say give them a snack and give them something to do. Take a walk. Do something. Do something. Play bingo. I don't care what it is, but you got to do something. Hallucinations and delusions, it's very real to them. Go into their reality, because you're only going to you're going to have a no-win situation if you don't. Because you're going to avoid a lot of arguments if you just go along with them. Just agree with them all the time. You're going to have a much pleasanter life, let me tell you. So the middle stages are typically when a family realizes that their loved one needs more help than they can provide alone. So those are really important things. So the wandering, make sure they're safe. We have to make sure, are they wandering because they're bored? Is it a medication side effect? Are they looking for something? Are they looking for someone? Are they trying to fulfill a physical need and they don't know where to look for something to eat or drink, to use the toilet? You have to be constantly aware. That's why we have so many memory units, because it's overwhelming for families. It's absolutely overwhelming. And then the incontinence is the next step in this whole thing. Holy moly. So incontinence is a big deal, and they don't even realize it sometimes. And we have to make sure that we use the adult depends, or whatever you want to use, but sometimes that just is a fact of life. So agitation, repetitive speech, paranoia, sleeplessness, and sundowning. I'm going to move on down here. Eating and nutrition, bathing. For men with a dementia, the inside of the toilet bowl should be darker. So you need to color the water or put a bright color lid cover on the toilet seat. Totally white inside and out does not allow orientation, especially for men while urinating in a standing position. So that's why we have so many accidents. So you need to, have the colored water, put a light shining down there, do something to make it a little bit more, out there, because most of the toilets and the floors, the sinks, the showers, everything's white, and they get lost in the shuffle, and maybe they have macular degeneration. They could have a lot of different things going on at the same time. So those are all things to think about. So some tips: keep noise to a minimum, get on their level, use direct eye contact. You may have to repeat the question in a lot of different ways. Response time may take several minutes. Use gentle touch, sometimes just a touch on their wrist, just to keep them focused. Smile. If you smile, everything's okay. They're happy because you're happy. They didn't make you angry. If you're sad and you're running around with a frowny face, they're going to think that they caused you to have a bad hair day. So always be smiling. It's so important, and everybody is going to be, it's going to be a good day. Okay. So ask simple, specific, closed-ended questions. Would you like the coffee or the tea? Would you like a turkey sandwich or a burger? Those are closed-ended questions. Okay. What do you want to wear? What do you want to drink? What do you want to do? Those are open-ended. Forget about it. They don't have the awareness anymore to answer you properly. So we really need to make sure that we are, going there in the right way. closed-ended questions, okay? Would you like to go to the park today, or would you like to go to the dollar store? You know, one or two choices. You want to wear the red shirt or the green shirt. Those are really important things to remember. Not what do you want to open the closet. It's overwhelming to them. Can't do it. Can't do it. Okay. So their word skills, their nonverbal communication. We have, you know, if they're ignoring you, leave them alone for a couple of minutes, come back, tell them you understand they want to be alone, return later. Sometimes it's just a matter of, you know, they're just gonna, they just are having a moment, and you know, they'll be okay in a couple, they'll forget about it in a couple minutes. So we really need to just kind of do that, come back and just say, okay, you know, I'm back again. You know, can I get you anything? How about a cookie? You know, those are some of the things we like to do. Okay, so practice your facial expression. If you have a frowny face, you need to smile. You need to make sure that they understand you're not mad, because they will think that they caused you to have a bad day. It's always their fault. So, you know, we have to speak slowly. We have to speak in a calm voice. If I speak like this, do I sound like I'm a little upset? Yeah, I'm a little upset. Okay. So we have to always speak in a calm voice, and that way you're not going to get that agitation level. Okay. The voice and intonation is really, really important. So that's why we have to be very, very slow and, you know, just slow. Okay. Strategies for communicating with residents who are non-communicative or non-responsive. Get their attention, get down on their level. Okay, if you have to bend down or if you have to sit down next to them, maintain that eye contact, very important. Yes or no answers will always work best. Listen with your ears, your eyes, and your heart. Those are things that, you know, and again, in the professional settings, we have to do, you know, holding hands, touching, hugging. We have to apply professional and ethical standards while considering the residents' personal, religious, and cultural preferences. Those are all things that we have to do. You know, so if somebody doesn't like to be touched, then we don't want to, you know, we can't touch them unless we ask permission, or, you know, there's a lot of different things going on here with religion, cultural preferences. I can't even explain it. I work in so many different environments, and I, you know, I see this all the time, and I see it with my own mother-in-law, because she doesn't like to be touched and she doesn't like animals. So it gets really kind of strange in her environment, you know. So avoid asking questions that rely on short-term memory, like what they had for lunch. No, what did you have for, no, did you enjoy your lunch? Yeah, maybe they enjoyed it, but they don't remember what they had. So, you know, what I have for breakfast, I don't know. You know, use humor, label the environment. I go into one facility and the floor is like, it's like a wayfinding. You can find your way anywhere because it all leads around the building beautifully. And they did it that way on purpose. Fragrance-free zones, no scents make good sense. So we never want to wear any kind of perfume, cologne, have other scents that may be very offensive to people. And we are, you know, we always have to make sure that we have, that we're respectful of that. I have scent allergies. Other people I know have asthma, have COPD, and you're going to trigger something. I know people think that colognes and aftershave and stuff like that is great, but to me, it's poison. And to other people, it might be too. So, and they're captive. You're hugging them, you're transporting them, you're feeding them, you're working with them, you're doing physical therapy, you're doing other things. And they're going to give you, you're going to give them a headache. So they're going to, you know, wow, get the heck away from me. You give me a headache every time I see you. So we have to be very respectful. You can wear it on your own time, but please don't wear it when you're working with residents in facilities or coming in to visit, because, you know, no scents are good scents in a lot of ways. So, There's a very powerful video. It's 5 minutes and you can watch it with Naomi and Gladys. And that's all you really need to type in Naomi and Gladys on YouTube. It'll pop right up. It's old, but is it powerful? Naomi File she was a social worker. She grew up in a nursing home, and Gladys was one of her residents. And the film, it's a 5-minute film. It'll change your life. That's the best thing I can tell you. She gets Gladys to come into her world for a minute, and it's just very powerful. If you want to see some more videos on Alzheimer's, I have my YouTube channels for level 1 for Alzheimer's in assisted living, and I have the YouTube channel for level 2, which is another. They're both of the level 1 is about 1 hour worth of videos, and the level 2 is about 1 hour worth of videos. So if you need more information on this, you're welcome to go to my YouTube channels and look at that. I have the National U.S. Aging. We have area agencies on aging all over the country. They've been around for over 60 years, and every county in America is served by an area agency on aging. They might not call it the area agency on aging, but they'll call it something. And there's a lot of help available with them. They can help you get Medicaid. They can help you with different resources, maybe getting a ramp put in, Meals on Wheels. They can help you with so many things. And it's not just for people that are over 65. It's also for people with disabilities. So as long as you're 18 and older and you have a problem and you need some help, that's a really good resource for you. Memory disorder clinics. Oh my goodness. We have 17 just here in Florida. They're all over the world. I don't care what country you're in or what state you're in, there's memory disorder clinics. That should be your very first step on the journey. Finding out exactly what's going on with this person is so important. And it's so, it's going to help down the road on so many levels, because we have people that have some very interesting dementias. And they can get some help. They can find resources. They can get medications that are proper for them, rather than the doctor just blanketing dementia and giving you Aricept. Well, that might not be appropriate for your Lewy body or your vascular issue or your Huntington's. Think that every disease is treated a little bit differently. So it's really important to get a memory disorder clinic, and you can do it yourself. You can refer yourself. You don't need a doctor's order to go through a memory disorder clinic. So just saying, okay, I took my mom to USF, to the memory disorder clinic back in 1992. Her doctor knew nothing of it. I went to support groups. I looked at area agency. I found resources that nobody even knew existed at that time. We didn't have the internet. We didn't have all this stuff. So you just have to do what you do and find out what you need to find out. Be your own advocate. Really important to do that. Brain bank. Brain banks are wonderful things. Okay, how do we find out for the next generation? The next generation of our our children, our grandchildren, whoever. Do you want them to develop this? No, of course not. So how are we going to get rid of this stuff? Through the brain banks, finding out what's going on. Is it an inherited thing? Does it run in families? Is it something that was caused by something else, by exposure to chemicals? I don't know, but that's where you find out. I had my mom's brain autopsied in 2000 when she passed away. And I've had all my Huntington's families, all my Lewy body families, all my Alzheimer's families, through my different support groups. And they are just thrilled when they get an answer. They have a definitive black and white piece of paper to show the family. I wasn't kidding here. This is what's really going on. And it's very important for future generations. So we need to continue that journey, and it's free. this is not going to cost you. Medicare, Medicare, your insurance companies, there's different disease initiatives in different states. So there's a lot of ways around this stuff. Okay. I know you listened to Sean the other day, so, but this is also through the NIH, the National Institutes on Health. They have legal and financial planning for people with dementia. There's a beautiful planning guide that you can download or you can order from them. So just go to the NIH and type in legal and financial planning, and it should pop right up for you. Okay, the VA and aid and attendance or housebound benefits. A lot of people don't know. My VA person tells me that over 90% of the people who are eligible for VA aid and attendance or housebound do not get it because they don't know. They don't know to ask. So ask. If you know somebody that's not receiving it, but their loved one was a veteran, like my mother-in-law gets $1,200 a month toward her assisted living tax-free because her deceased husband was in the Navy during Korea. So because of that, she gets assistance, and it's really makes a difference in her care needs. So I can afford to have her hair done every week, and I can afford to buy her some new clothes or get her toenails done or whatever it may be, get her special foods. I can afford to do that because she gets that extra money every month. So, those are things to think about. Okay. Oops, I didn't mean to go there. Okay. Okay, so in conclusion, there are no cures right now for the many forms of dementia caused by progressive neurodegeneration, including Alzheimer's disease. But hopefully I'm giving you a little better understanding of this and how you can make a difference for these people, their caregivers, whether they're professional caregivers, family caregivers, to help, live their lives more fully and to meet those increasing daily challenges. It's never ending on this disease process, and the challenges get worse and worse as the disease progresses. So we wanted to give you a starting point for all of this. This person with a form of dementia is not in control of their behaviors. They cannot change. We have to respond with appropriate interventions, empathy, and wayfinding guidance, not only for this person, but for their family. So let's make a difference for those affected by a form of dementia and its many presentations. Okay, so that's my presentation for you. I'm going to go back to the beginning here. And what I need you to do, oops, Kurt, do we have that other, how they can get their continuing? And I have 19 people with their hand up. Do I click in there?
Do you need to share your screen anymore?
Not this screen, no, but if you have that other one, okay. This screen right here, the one on the right. Oops, that one. Can I click on that?
It's shown to everybody.
I'm sorry.
It's shown to everybody.
Okay. Okay. So can I talk to them now or not?
Yes.
Yeah, okay, so how do I
Just
go?
talk to it.
Okay, but I can't hear them.
You can't hear them because you're the one presenting. You're the only one that can talk.
Okay, but if they need to ask me questions, I can't.
You'll have to put it in chat.
They'll have to put it in chat. Okay, so, okay, I have chat. Okay, so click on the chat. Okay.
Yeah, so there's a question in the chat. One question says, will these handouts and links to these videos be shared?
If they email me, I can email them the links. Absolutely.
Okay, so you see in that red box, you need to email Dr. Karen at bookofhope.us.
Absolutely.
And for anybody who wants to get to see you, just follow the instructions in that red box. If you have a phone, take a picture of it right now with your phone, and then you can see very easily how to do it. Is that clear for everybody? Mhm, mhm.
Okay. Oh, wow. Okay. So, okay, I see something on here with Lewy body. Her husband has Lewy. So my suggestion is definitely contact the Lewy Body Dementia Association. They're based up in the Atlanta area. They are wonderful. If you send me, anybody who needs more information, just send me an email. Just say, you know, question or whatever at the top, and I promise to respond to you. Okay.
It is Dr. Karen.
DR, yeah, DR, not the whole word doctor.
I'm going to type it in the chat right now.
Okay. 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 So anybody who wants the certificate, what you're going to have to do is go to my website, and that's all listed up there on that first page, the conference information. And we're gonna, you know, you can send me, go to our website, donate $10. You will see flamingos. If you don't see flamingos next to a donate box, don't go there. It's the best thing I can tell you. But my dementia caregiver resources, and then send me your name exactly as you want it on your certificate, and then I will email you your certificate.
And if you're not sure of anything, just email her
Absolutely.
at Dr. Karen at bookofhope.us. I put it in the chat.
There you go. Okay. Thank you so much, Linda. This was great. So, all right. I appreciate
Thanks so
that.
much. Thanks for being with me, Karen. Have a delicious day.
Thank you, Linda. Bye-bye.